Dr. Riklon, welcome. If you could state your name for the record, and welcome from Arkansas.
Yahweh and greetings, Chair Patterson, Vice Chair Knopf, and members of the committee. My name is Sheldon Riklon. I'm a Marshallese Micronesian family physician currently residing and working in Northwest Arkansas. I'm the medical director for the University of Arkansas for Medical Sciences Center for Pacific Islander Health in Fayetteville. I'm very honored to be able to join you today to provide testimony in support of Senate Bill 557. Now you may be asking, why is a doctor in Northwest Arkansas testifying for an Oregon Senate bill? Well, I'll tell you why. My father was a medical officer or doctor from the Marshall Islands. He practiced and serviced many patients for many years. He was one of our pioneer medical doctors. He was a mentor and a role model who believed in serving others selflessly. My mother was a registered nurse from the state of Kosrae in the Federated States of Micronesia. She also was one of our pioneer nurses in the islands. And as you may know, and as Senator Byers also mentioned, that both the Marshall Islands and the Federated States of Micronesia are part of our COFA nations. So regardless of my current residency and practice in Arkansas, my COFA family is across this great nation, including the beautiful state of Oregon. As Pacific Islanders, we are one family, and we do our best to take care of each other. We grew up as one family spread across thousands of miles of ocean. However, I must say I am personally amazed at the great and progressive work that the state of Oregon, with your leadership and engaged committee's support, have done to advance the policies through legislations that relate to our COFA families in Oregon. Thank you so much. Your progressive work resonates in other states, including Arkansas, where we follow what's happening in Oregon closely and try to follow in your footsteps. As a family physician, I take care of patients and families from many backgrounds with many different medical conditions. As a practitioner of public health, I understand the needs and challenges of many of us living and working in the United States, as well as in the Pacific Islands. The social determinants of health are vital metrics we know that need to be addressed for health and well-being of an individual, a family, and in a community within each state. These are conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Today, we are focusing on one of those components, health, more specifically, dental health. There's a synergistic relationship between oral health and overall wellness. Gum disease is linked to a host of illnesses, including heart disease, diabetes, respiratory disease, osteoporosis, and rheumatoid arthritis. Oral health is fundamental to overall health, well-being, and quality of life. It spans from infancy, before the infant starts to see the dentist at age 6 months, until elderly age. It does not stop at age 64. The condition of our teeth may be a sign that you have one of the conditions that I listed, or could make those conditions worse. COFA citizens have a high rate of diabetes. For the Marshallese, this ranges between 25 to 40% in comparison to the U.S. rate of about 8 to 10%. People with diabetes have a higher chance of having gum disease. Gum disease can lead to pain, bad breath that doesn't go away, chewing difficulties, and even tooth loss. Diabetes can slow down healing, so it can interfere with treatment of gum disease. Diabetes does not stop at age 64. A study in 2018 found that brushing your teeth twice a day for at least 2 minutes may lower your risk of cardiovascular disease. A separate study found that gum disease appears to worsen blood pressure and interferes with medications to treat high blood pressure. Heart disease and hypertension and many other chronic conditions do not have age limits. I present you these examples that oral health as important relationships of the health and overall well-being of a person. It is vital that oral health services are accessible and available to all age groups. A report from the Institute of Medicine and National Research Council of the National Academies in 2011 found these three overall conclusions. Number one, improving access to oral health care is a critical and necessary step to improving oral health outcomes and reducing disparities. Number two, the continued separation of oral health care from overall health care contributes to limited access to oral health care for many Americans. Number three, sources of financing for oral health care for vulnerable and underserved populations are limited and tenuous. And number four, improving access to oral health care will necessarily require multiple solutions that use an array of providers in a variety of settings. It is for these stated conclusions that Senate Bill 557 is one of those many solutions, that I am in strong support of Senate Bill 557 to ensure that our respected elder COFA members have continued access to dental care in the beautiful state of Oregon. Komoltada, Kulumalalap, and thank you for the opportunity to testify, Madam Chair.
Thank you so much, Dr. Riklon, for your testimony today. Appreciate your time with us.